I have been joined by Ignatius, Terrence, Nnubeng, who's the Director of Advocacy and Research at the Africa Center for Health Policy. Good morning.
Good morning.
How are you?
Fine, thank you.
Thank you so much for being with us.
Thank you for having me.
I've also been joined by Ibrahim-Tanko, Amidu, who's the Executive Director of Star Ghana. Good morning.
Good morning.
How are you?
Fine, thank you.
Thank you so much for being
My
with
pleasure.
us. We'll take a look at our first story. I'm reading from Daily Graphic, and it says COVID-19 opportunity to self-produce. That's coming from the president. So the president, Nnubeng, has said the coronavirus disease pandemic presents an opportunity to Ghana to reduce drastically its over-dependence on imports. He said the pandemic would have some consequences on national life, but the country should take the opportunity to start manufacturing some of the things it needed to manage the situation. So he said this as part of the opening remarks when he met captains of pharmaceutical companies, managers of the central bank and commercial banks, as well as regulators in the food and drugs business at the Jubilee House yesterday. I'm going to quote the president. He says, "We are not taking just pharmaceuticals. We are not talking just pharmaceuticals, sorry. We are far too dependent on the things made abroad and imported by us for use. We should be making most of the things we use in Ghana ourselves. And I am seeing what is happening to us in this crisis as an opportunity. It is very big. It has very big consequences, but it's also an opportunity. They say necessity is the mother of invention, and advisedly so." So he goes on to talk about Ghana producing hand sanitizers, Ghana producing masks, some of the banks working directly with the pharmaceutical companies to ensure that we are able to produce all the resources we need to fight the virus locally. So Ibrahim, I'll start with you on this story of manufacturing the produce we need for coronavirus locally.
Well, I do agree that the situation presents some opportunities, but opportunities need an enabling environment. They need a set of policies, etc., to translate into concrete results. Mm-hmm. And if you follow what's happening in the US, even in the UK, in the US, the federal agency responsible for monetary policy has cut interest rates almost to zero. Mm-hmm. It's happening in the UK too. They've taken other measures to ensure that the environment, the enabling environment, is created for business to be able to thrive. So I think that if the government wants us to use this as an opportunity to produce more, to, etc., then let's look at the interest rates. Let's look at the funding available to the industry. Let's look at even the policies. Recently, the Ghana Chamber of Pharmacy did a survey of the regulations around, businesses wanting to set up in that sector. And the number of regulations that they counted, they said, well, then people might actually prefer to import. The Private Enterprise Federation also did a similar thing and came up with all the regulations and the hoops that industrialists, manufacturers have to jump through before they can get through. So I think, yes, this presents an opportunity. But for that to translate into reality, we need to look at the policies and also to find out what can we do to support them. Mere scarcity doesn't translate into an ability to produce. Scarcity provides an opportunity. And then to take advantage of that opportunity, you put in place policies and measures that would make it possible for these guys to.
Do you think we'll be able to still compete on price points with some of these products that we normally import into the country? Well,
in my opinion, depending on the incentives that we provide, because China is reeling, from the pandemic. Production has gone low. They are trying to, face all the attendant problems, and so that might actually give us an opportunity. But like I said, what do we need to do? We need to really, really, really examine the barriers, the constraints. What is it that has made it very difficult for us to be able to be competitive and to see what measures we can put in place.
Thank you. Yeah. Ignatius.
Yeah, so a very good morning to all your cherished viewers. Yes, I think it's some piece of very welcoming news, so we must embrace it from that angle. However, I think I would agree with Ibrahim on a point that it must translate into policy actions.
Okay.
Things that would enable us to create that enabling environment for them to thrive. One key thing that is actually happening in this pandemic has exposed us as a country to the availability of resources, be it structural, human, financial, all over, across the cascade. And why is this so? Because even as at now, a lot of the PPEs and other things that we would need have not yet gone to the various localities and the various districts. A lot of the districts even are still complaining that they've not have had those resources to function, all because most of them are imported. And the imports actually, cuts or kind of protracts the process of providing these equipment for our use. So I think it's very, very welcoming news that we are having as a country. However, we need, as a people, to translate it. Some years ago, I remember we made the effort to produce antiretrovirals in the country. And if the enabling environment was created for those pharmaceutical companies, we would be producing by now. And as at now, I think it's possible that we can still go ahead. So I think we should welcome this.
But how do we ensure that, people are not also experimenting in their homes, bringing out substandard products because we are producing locally? How do we regulate that aspect of things?
Okay, so as a country, we have regulatory bodies. We have the Food and Drugs Authority. We have the Ghana Standards Authority. And these are duly licensed and duly accredited bodies that are supposed to check these things for us. Nobody can just get up and start producing, because the facilities and then the state institutions that are supposed to actually get these equipment are supposed to get them from the right sources. And I don't think there's any hospital or any district health directorate or regional health directorate that will go in to procure from someone who is just experimenting from the corner, so to say. So I think if our systems are allowed to work in that regard, we will be able to produce for ourselves.
Have we equipped our health professionals enough to fight this pandemic?
Okay. Equipped, yes. Well equipped, I don't think so.
Why do you say that?
In my earlier submission, I made to you that even as at now, as we speak, somewhere last week, funds were made available for, the purchase for COVID-19 in the country. But almost a week on, we are still here, and then various facilities, various districts are still complaining that even this morning, GMA and other bodies are still talking about more logistics to be, procured, and then government getting them for us. So if they are also talking in this regard, it means that we don't have the resources well enough for use in our country.
And how would that inhibit our ability to actually prevent this disease if it becomes a very big threat?
Oh yes, it will be quite worrying, because as a country, we are putting in so many measures to actually to curb community-wide spread of the virus. And if that's the case, and then we are still not being able to get those logistics, I think it will have major implications, because, mind you, the health workers, they are humans. And then we have that flight ability. We would want to flee from certain conditions. That I heard Dr. Ignatius Bono somewhere yesterday or so telling medical laboratory scientists and like that, if they don't have the needed resources, the needed PPEs to work with, they should actually stay back and not go in. Yes. So these are issues that are key issues that we should address. So it would affect us if we are not able to get the needed resources to fight it.
So the president has committed $100 million to fight this. How do we ensure that it trickles down to the level where health professionals have everything they need to sufficiently fight this battle? It
would, if it is not only a top-down approach.
Okay.
We should limit the bureaucracies that we are having in terms of all the bottlenecks that we have in terms of funds allocation and all that. Okay. These are key. This is an emergency situation. And if we are still using those same approaches that we are using previously, I don't think we'll be able to deal with it as we want to.
Okay, thank you. Ibrahim, back to you. Yeah. So the Christians, Muslims have come out to say that they are not opening their mosques, we are not opening our churches to ensure that we don't spread coronavirus. What role should private institutions play? Is Star Ghana still open?
No, we're working from home.
Why?
Well, I think our work involves contact with a lot of people from different, walks of life. And we want to ensure that people have the opportunity first to work from home so they don't come into contact with others. But also that, we see people as staff, we also see them as parents. And the schools have closed. Perhaps the staff may need a day or two to ensure that, the children are settled and etc. So we've provided everybody with enough data and all the other things that we work from home. Where it is necessary to meet, we ensure that the numbers are quite small and then we follow all the relevant protocols.
Should other businesses and organizations also do same?
It depends on their business.
Okay.
I think Citi cannot work from home, as it were. You would need people in here for this. But wherever possible, I think we should minimize the movements, we should minimize the contacts and etc. I mean, that helps to prevent, opportunities for infection. So I would advise that if it's possible, yes, that's the way.
Work from home.
Yeah.
Okay. Yeah. Ignatius, beyond the churches and the mosque, what should public health advocates do about our marketplaces where, people are still touching one another? How do we ensure that we limit those places as well?
Okay. So as public health practitioners, I think our main preoccupation should actually not just be with the recognized markets, actually, because you go to a place like the mall, it's well regulated. Somebody at the entrance to the mall, you can easily, wash off your hands and then use the appropriate disinfectants before you enter. But then the main issue has to do with our local markets, whereby you find people selling along the streets and all. Those are the places that they should be targeting because they would serve as the main source of propagation currently. So I think our main preoccupation should be on that side.
But where do we even start from? Because if you go to the mall, you know that, okay, there are different stores. So all these different stores can take initiative to say we have a washing place, we have hand sanitizers. But in the market, it's like a free-for-all type of system. So how do we ensure that customers are washing their hands, traders are washing their hands?
The various assemblies have a way of collecting their various tolls from them, I suppose. They do have a way. So once they are able to collect their daily tolls from them, we should be able to use that same approach, that same channel, to also ensure that we are also, they are also adhering to the standards as well.
Do you think we've paid enough attention to the informal sector as far as preventing coronavirus?
We have paid some attention, but not enough attention.
What more could we be doing?
We could be engaging more with the leaders of the various markets, for one. Even I heard in the transport sector today talking about, ensuring that people wash their hands at the various stations. The stations might not be the problem. The problem will be those who pick their cars along the road. Just by the roadside. How do you, if the person is speaking from along the road, just at a bus stop, how do you ensure that the person washes their hands before boarding the car? It's going to be a problem from that angle. So our issue now is not going to be with the recognized institutions, recognized markets. It's going to be with other institutions, other bodies, other persons who are actually not even within the informal sector, who are not recognized, can't be found at various, stationary places, those who are actually transient moving. They are going to serve as our main source of contact. That I think that public health practitioners should be paying a lot of attention towards that side as well.
So beyond engaging pharmaceutical manufacturers and the banks, is there a role government should be playing in engaging people who sell secondhand clothing, materials that may potentially expose Ghanaians to the virus?
Yes, sure. For one, I believe that for those who are, selling these kind of items, that can actually have the potential. I think there should be some rigid kind of screening for them, because if not, these things would still get into the system, and then we'll have a problem as a people. So I think we should actually pay attention towards that side as well.
Ibrahim, so you're in the developmental space, non-profit space, the non-Ghanaians in the countries who in a country who may have just been back a week or two ago, what role should they play in proactively engaging in perhaps getting tested, isolating themselves from people, and us as a people too? How do we ensure that we don't stigmatize people who come out testing positive and making them feel shame for testing positive?
I think a lot of it is down to public education, because the issue of stigmatization would always arise whenever there's a disease that scares everybody, be it HIV, be it Ebola, etc. We see those infected and sometimes even affected as people we shouldn't even get near to. Of course, I mean, in terms of preventing, we shouldn't physically get into contact. But I don't think that we should stigmatize. And I think 2 days ago, somebody called me and said, oh, well, they were on a flight somewhere and they saw somebody, I wouldn't mention the country, board the flight from Accra to, and they were worried, why should that person be allowed to board to? So we were just assuming that because of that person's nationality, he or she was a suspect, But even we Ghanaians here, we are suspects, in the sense that we don't even know when the thing started. We know when it became public with these 6 people, but we actually don't know when the first people may have come into the country with it. And therefore, I think the issue of stigmatization should be addressed, both in terms of foreigners, but also even for Ghanaians who may contract the disease. And I was just following up on what Ignatius said. A lot of what we need to do is also cultural.
Okay.
You talk about self-isolation. That works for us in the middle class. I'm in a bungalow or distant flat with my wife and children. I can self-isolate, go into one room. How do you self-isolate in a compound house? How do you self-isolate in some of our communities that the houses are built, on top of each other, next to each other? How do we contextualize some of the strategies so that we don't say that, well, the agreed strategy is self-isolate. I live in a compound house where we share the same bathroom, the same toilets. What do I do? We talk about wash your hands under running water. And your station has even done a number of programs on communities where access to water is such a huge challenge. What do they do in those situations? We, those in Accra and the urban centers, are finding it very difficult to get sanitizers, hand sanitizers, and etc. Not to talk about those outside. What do we do? So, yes, let's go ahead with the public education, etc. But let's not make it look like it's an urban phenomenon. And so we target it at people who can self-isolate by going to their rooms or go to your washroom and turn on the tap and wash your hands and etc. But look at those whose context may be a bit different. And we see what do we need to do to ensure that that information is quite relevant. And I think the religious leaders are showing a lot of leadership. Those that have agreed to modify ways of worship to ensure that we reduce the opportunities. I think there's a lot of leadership that they have shown. And we need to target these religious leaders, these traditional leaders, to carry on the message. Because some of the changes that we require go to the heart of who we think we are and how we worship and how we live. And so for people to make changes to the ways of worshiping or burials and etc., they need to hear from their traditional authorities. They need to hear from the faith. So let's bring them more into these awareness campaigns.
Okay. Now, finally, your recommendation on ways to ensure that the almost 30 million Ghanaian people are all engaged in preventive measures against coronavirus.
And I think that's the thing about sending the awareness creation to the lowest levels. As Ignatius said, let's ensure that we do away with the bureaucracy so that decisions can be implemented quickly. Let's look at Ghana beyond the urban areas. Somebody was talking to me about Boku in the Upper East region, which borders 2 countries, Burkina and Togo. And we say that the customs officials there, the hospital officials, nothing has been sent or was there as at yesterday when we were speaking. What do we do in those situations? So I think let's decentralize a lot of these things. Let's ensure that we have the material, and let's involve everybody in passing on the message and, supporting the efforts. Yeah.
Okay, now Ignatius, we're going to go for a quick break, but after the break, I would want you to answer the question of how do we ensure that our health workers have everything they need, because they will be our first point of contact should any of us end up with the virus. But we'll go for a quick break and then you answer the question. This is still Breakfast Daily on Citi TV. Thank you so much for staying with us. If you have any questions or contributions to the conversation, let us know with the hashtag Breakfast Daily, and the WhatsApp line is 0550585832. If you're outside Ghana, the country code is +233. We'll be right back. Welcome back. This is Breakfast Daily on Citi TV. Thank you so much for staying with us again. It's an interactive show. We want to hear from you. So if you have any contributions to the conversation, let us know with the hashtag Breakfast Daily and the WhatsApp line 0550585832. We are still discussing coronavirus. The president meeting with captains of the pharmaceutical industry to ensure that Ghana is able to produce hand sanitizers, face masks, and other resources we will need to fight this virus. And before the break, I was asking Ignatius, who is the Director of Advocacy and Research at the Africa Center for Health Policy, if we've equipped our health professionals enough, because they will be our first point of contact. And we know that even in the developed world, some health officials have contracted the virus from their patients. So, Ignatius.
Okay, so in the first place, we have allocated resources as a country, over $100 million. Mm-hmm. That is perfect. That's good. It's good enough to provide everything that we need. However, the main problem is that we are using a top-down approach. So as we speak, people on the ground have not yet received them. So the health workers, on my way here, I placed a call to a few of my colleagues. We were all trained at the University of Ghana School of Public Health together. I placed calls to them. They are actually at the north, Savannah region, and then Upper East. And trying to find out whether they have the things. And then one of them is a district disease control officer. And he tells me that as at now, well, they have been given some assurances that the things are going to come, but then they are not there. So how do you expect a human being, in the first place, a person is human, so how do you expect that person to just go with his bare hands or her bare hands and go and nobody will do that actually. So I personally believe that we have not done well enough for our health workers. Today, schools have been asked to stay at home. Churches are not moving. But the health workers, they are supposed to be at work. They are supposed to be battle ready. But how is one able to become battle ready when the person is not having the needed resources to work with? So we may end up going to the health facility, and then when those procedures are not done for us, we may blame them. But it may not be their fault. Not because the government, not because they don't want to work, but because the things that they are supposed to work with are not there. Is there any insurance policy in place for all health workers in this time of crisis that if should any health workers contract anything of this sort, that person is well catered for? Go outside the country. Go to the advanced world. Sometimes it's not good to compare, but then they are the people that we should be learning from. And then they have these kind of packages for their health workers, such that if anything happens to the person, they know that all the frontline health workers, they know that they are going to be protected in one way or the other. But then that is not happening in our case. So I think the resources that they are needed to work with are not yet there. One other thing that one other angle that I want us to look at has to do with the financing of healthcare institutions in the country. Over some few months or some few weeks ago, we heard the Chamber of Pharmaceuticals, talking about they suspending services to various health institutions that we have in the country because they have not been reimbursed for NHIS and all that. If this situation should go on, it would actually affect us because some of the protective equipment, like the gloves and things, the hospitals have been procuring them on their own, even before this virus set in the country. So if we had been paying a lot more attention, I'm not saying attention is not being paid, nobody should misconstrue it, it's in a political sense. But then, if we are to pay a little bit more attention to healthcare financing in the country, such that the health facilities are able to provide, and procure the things that they need on regular basis, on regular underlined basis, I don't think we'll be here talking about these things. There are some things that, yes, we would need in emergency situations that can be provided by central government. But something like gloves, every health worker, frontline health worker needs gloves to work with. And we cannot say that we are waiting for central government to bring us gloves. If our financing mechanisms were really working, by now all the facilities would have procured their own gloves, such that and other equipment, so that they are able to deal with it at first glance. But then that is not happening as a country, and that is where we need to pay much attention to. Yes, it is very true that they are thinking of getting all these things produced locally. Some of them are produced outside, a lot of them. But whether they are produced locally or they are produced externally, we should still be looking at healthcare financing in the country.
And if we don't pay a close enough attention to the two things you mentioned, how would that now, mess up the chain we have now of saying, if you see a symptom, if I see a sign of maybe I may have coronavirus, let me isolate myself from my family. I'm living in a compound house. Maybe for 3-4 hours, I'll succeed at that. How will that chain of the health worker coming to test me, giving me the medication I may need, what does that whole chain look like?
Okay, so I am a health worker in one remote area, very far away from the regional. Exactly, very far away from the regional isolation center or wherever, whichever isolation center is supposed to. I see a case definition, a suspected case definition, which I'm supposed to go further and then even do clinical investigations to actually check whether that person is actually meets the clinical criteria, and then for confirmation at the designated facilities. I see it. Oh yes, I've seen it. I'll rather stay behind. Place a call to the next available chain of which is far away. Yes, I have seen this person, and I think the person needs come and pick the person yourself. Is that the kind of healthcare we want to be happening in our country? And that is what will happen if we do not pay attention to them. They would be apprehensive to work. So we should, as a matter of urgency, be looking at that angle.
Thank you. Take a look at our second story from citinewsroom.com. Stricter measures needed to deal with coronavirus. That's coming from Badu Akosa. And you're speaking on Point of View last night. So a former Director General of the Ghana Health Service, Professor Ajemain Badu Akosa, is advocating for a more far-reaching directive from government with regards to international travels and internal movements in order to tackle the spread of the novel coronavirus in Ghana. So I'm going to quote exactly what he said last night. I don't think that the current directives will be enough. It needs to be more far-reaching, and it is important that we do it at this stage, because if we allow one community infection, as far as I am concerned, that will be the trigger. I think that the best scenario is to assume we have community infection and seriously think about the next move. He goes on to say, it is better for us to compulsorily quarantine anyone coming from any of the countries where there is an in-country case for 14 days, because it is important that we make sure that nobody is bringing this infection into the Ghanaian community. So we know that the 6 people who have been identified as positive have contacted, they've engaged over 150 people. And Dr. Akosa is saying that we should quarantine anyone coming in from any of the countries that may have coronavirus for 14 days. Do we even have the financial resources to pull this off, Ibrahim?
Yeah. So I agree with Dr. Akosa or Professor Akosa's suggestion. But then, like you said, there is the decision, and then there are the implications. So we quarantine those who come in for 14 days. Where do we do that? Do we have the facilities? Have we planned for that? Perhaps it may be a bit easier in Accra, Kumasi, Takoradi. Going to the other areas, where are you going to quarantine them? Have we even set up quarantine centers, so to speak, for those who are showing symptoms and etc.? Not to even talk about those who have come in, but we just want to isolate them for some time to look at whether they will develop their symptoms or not. So these do have implications. And so I might not go for the full quarantine. Those who can self-isolate, I think we should have some protocols in place that would enable them to self-isolate. Those that we are not sure of, then perhaps we can use the limited facilities that we have. People don't only come in through the airport. Yeah. I get a bit worried that we are focusing a lot of the conversations around the airport, ban flights, etc. Our land borders, what are we doing? The immigration officers and etc. who are the land borders, how have we brought them into, the measures that we are putting in place to ensure that we contain this thing? And the thing with the corona or COVID-19 is that the snowball effect. Mm-hmm. You just talked about one person, they've traced to 100.
Well, they think the 6 people may have come into contact with over 125 people.
And I think it's a very gross underestimation. Because the person has come into contact with his or her immediate family. They have gone to school and have had contact with others. Their spouses may have gone to workplace and had a contact with. So it is something that is scary. Look at Italy. Look at Spain. From almost zero, then bam, So we need to take these measures very seriously. The flights, those who come in, what do we do? Outside Accra, how do we quarantine? I think it's really is key.
Okay. Yeah. Ignatius, so far all the 6 cases were imported cases, but the professor is saying we should pretend as if we have a community situation. Should we program our minds to assume that the worst is here already, and how would that help speed up the process of preparation and prevention?
I think I totally agree with Prof on this. As a policy think tank, we were speaking about this issue weeks ago, that the measures that we are currently implementing now should have been more proactive, and they should have been done about 2 weeks ago. If this measure had been put in place about 2 weeks ago, we would actually be a step ahead.
But wouldn't we have come across as paranoid because we don't have any cases? Why are we stressing ourselves?
We wouldn't be paranoid, judging by the fact that in our country, our health systems are not as developed as that of Italy, as that of the other countries, the other European countries. We have not even gotten to a microcosm of what they are having there. And so if we are aware of this our situation, that this is our current healthcare system, then we should rather even be going the extra mile to ensure that we didn't even get here in the first place. However, we are here already. And I think we should be looking at the next step, and that is what Prof sought to even put out. That, yes, we have put in certain measures, which are good in any way, but then the measures should go a step further. Assume we are trying to prevent community-wide spread, but let's assume we are already having community-wide spread, because this virus has an incubation period of about 2 weeks, 14 days, within which the person can actually transmit. During that period, the person can transmit as well. So we should rather be looking at it from this angle that, yes, let's assume I have it, you have it, everybody's having it. Let's go into the next stage such that we do not get there and curb it from that angle. And that would help us. So we should be looking at a more proactive approach and not the reactive that we're actually doing now. Because these measures were instituted because we had 2 cases, then it increased to 4.
Yeah. Or 6, actually.
Yes, so increased to, we had 4 more cases. To now we have 6. Yeah. And I'm actually thinking that, judging by the fact that it's a propagated kind of infection, we should be looking at more cases within the coming weeks or in the coming days. So if we do not actually look at it as from that angle that, yes, we already having a community-wide spread and institute the needed measures. If not, I'm quite, I don't want to use scared. I'm not scared, but I'm quite skeptical. I'm quite worried that we may not be getting that result that we want to be getting.
But the reality is that we don't have the resources, and even countries that are more developed than us do not have the resources to do something like quarantine anyone from the countries that are affected for 14 days. But we also know that there are people who don't even show any symptoms of coronavirus. Last night, Idris Elba came out to say he tested positive. He's not showing any symptoms. So should we be worried that we may be walking around fine and we're passing it on to each other?
Oh, yes, sure. We should. Because in the first place, I think what we should be looking at right now is the fact that, as you indicated, people are, people are, coming up with all these, all the big stars, they are coming up that I'm testing positive and all that. But let's look at it from this angle as well. If we had started this thing way back, we wouldn't be where we are. But then we didn't start it that way. Our health system isn't as robust as we have it elsewhere. So we should rather be looking at we should have been looking at the 4 levels of prevention: the primordial, the primary, the second. Now we are at the secondary stage of prevention, which means that the cases are already there. So we are trying to prevent it from escalating to the next level. But then, if we had actually been much more particular about the primordial and then the primary, at that level, we would not even be where we are currently.
Okay, thank you. Ibrahim, what's the role of the, private organizations, non-profits in fighting this? Because there are communities in the country that will not have access to soap, running water, and the government may not have the financial resources to reach all of them.
I think this is where we all need to put aside our skepticism about government. And when I talk about government, I'm not talking about this government, but usually when they talk about money, government has voted, everybody says, it's going to be, another procurement scam, and etc. For us to see how we can, in our own ways, as individuals, as organizations, as philanthropists, also contribute. Because even in the so-called economically developed countries, you do have philanthropists who are coming in and saying, look, we're going to support the production of masks, we're going to do, etc., etc. And so I think this is the time for our philanthropists, our high net worth individuals to step forward and see what they can do. If you don't trust government to manage the money that you would donate, why don't you adopt a district or a region or whatever and help them to set up, of course with guidance from the technical people. Why don't you see how do we sink boreholes that will enable people maybe to fetch water, put in those buckets, and then you'll be able to wash your hands under running water. And even for us as individuals, perhaps maybe a challenge to Citi. Launch a campaign. Donate 1 cedi via Momo. Let's use that to reach those that are not being reached. If you know the population of street children in Accra alone, the conditions under which they live, the potential of one of them getting infected, and how that can spread, and how are we reaching them? Because these are not stationary; they are moving around, they are living from hand to mouth. So let's think creatively, and say beyond the $100 million, that we should all take an interest in monitoring how government uses that and accounts for that. What else can we do as individuals and as philanthropists to help?
Thank you. We'll take a look at our next story, and it has to do with the National Identification Authority. They are still continuing their mass registration in the eastern region. So I'm going to read what they said. I'm going to quote some of the points they mentioned. They said the mass registration exercise currently underway in the eastern region will continue under specific guidelines as follows. All supervising registration officers are to ensure using appropriate queue management techniques, including numbering and appointment systems, to ensure that no long queues emerge at any registration center. All SROs shall ensure that no more than 25 persons, including field officers, are present at a registration center at any given time. They go on to talk about registering people immediately when they arrive, making sure that you wash your hands with soap and water. But unfortunately, all efforts by the authorities since last Thursday to procure hand sanitizers to distribute to field officials have been unsuccessful. We spoke to our correspondent there before the news review. He told us that there are more than 40 people there. There are no hand sanitizers. Should NIA still continue with this mass registration?
NIA is not an independent republic. It is a government agency. And I think what they are trying to do is completely unacceptable. And this is how the system breaks down. That this is a situation that calls for coordinated efforts. Everybody obeys the protocols and the instructions. As soon as people begin to choose and select what they would obey and what they would not obey, then we might as well just give up And so they have to be brought to book. And I think I don't want to use very harsh terms, but in a way it's irresponsible
How so?
to put your staff in harm's way. You haven't even procured the sanitizers. At the very least, you say your people are running around trying to get gloves and etc. And yet you are asking them to go ahead, ignore all the protocols that were announced even by the president of this republic, and to say go ahead, but make sure that they are only how do you even, this social distancing that we are talking about, even if there were only 25 people, is somebody going with a ruler to measure and say, okay, you stand here, you go 1 meter? Who is going to look at that? And a lot of the registration centers are not even in closed environments. You have this open, they sit under a tree, and you're going to say that only 25 people can come near the tree to register? I mean, it's completely, I can't understand the thinking that went into this. Is it that something, they have procured perishables, that will get spoiled if they don't use them? Or what is it? Universities are shutting down, schools are shutting down, etc. And then you say what? We don't think we need to shut down? And you should have trained your staff even well ahead before asking them to implement these protocols. You haven't. You've just issued a press statement or whatever, and you're asking them to do that. Why would you do that to people who, beyond being your staff, are parents? They are breadwinners. I mean, anyway, I don't know. But I think this is where I think the president should put his foot down and said, I ordered that this has to be done. The churches, the mosques, which are not even government agencies, are obeying. Why would an agency, that is governmental, decide that they wouldn't do it?
Okay. Ignatius. On NIA and matters arising.
I have colleagues who are actually on the NIA team in the Eastern region. Wow. They sent me, one of them sent me this circular that is going around, this press statement yesterday. And I just laughed. I found it so laughable. I was like, wow, these are great measures, but they are theoretical.
How so?
They are just theoretical because you cannot practicalize them. Because have you been to a registration center before?
People just sit on a bench together.
Just a bench with so many people seated on it like that. How do you expect them to observe these ones? Aside that, you yourselves, you have placed it in your statement that you have not been able to procure the things for them.
Exactly.
And you will still want them to go ahead and do this. How so? How is it possible? It's not possible. Even, I know they have a pen, which they use to, So he was telling me that now they have bought two. They have two. And so the officials are using one. And when you come as a person coming to register, they will give you another one. So yours is there waiting for you, and then they have theirs as well. Which is also a very, very serious issue. Because in the first place, even the scanners and the things that they are using, they need to be disinfected after every single use. This is a case that you are not having them to actually disinfect them. I think, yes, it's true that a lot of resources have gone into this process and they are far advanced. We acknowledge them for that. They have done well. But in this case, in this particular instance, I actually think that they should actually suspend it and wait for this whole thing to actually subside before they consider moving on. If not, we may be here thinking that probably Eastern Region has not recorded in any case. But mind you, the chain of contacts, we may end up finding people who would move from here to even go there because they couldn't register in Akwa. They have relatives in the Eastern Region. They want to go there and go and register. They may end up going there, then it will serve as a problem for us. Yeah. So I think they should actually just put everything on hold. And then they shouldn't look at the resources it's going to have a lot of repercussions. This virus is having a lot of repercussions. I had to talk about aviation having about 20% cut and all that. So it's going to be a chain of effects on every place. So let's not prioritize resources over lives.
Yeah. And I think this is a test case for the government. If this is allowed to go on, believe you me, others would come up with similar exemptions for themselves and say, oh, we have put in place the protocols. Worshippers will stand one meter away from each other.
Speaking of others, the charismatic bishops don't agree with the ban on religious spaces. So I'm reading from Citi News. It says lack of engagement before ban on religious activities wrong. So the Ghana Charismatic Bishops Conference has expressed disappointment with the state for not engaging them before a ban was slapped on all religious activities and some public gatherings in the country following the coronavirus outbreak. So I'm going to quote them. They says that the arbitrary closure of churches and places of worship without consultation or discussion for 4 weeks smacks of disregard of the importance of the church's role in the country. This disregard of the place that is the place of this powerful social and religious institution to which over 70% of Ghanaians belong is wrong. They go on to say that nightclubs are open, malls are open, banks are open, drinking spots are open, chop bars are open. So why is it that churches have to be closed? Ibrahim.
I think, for something as drastic, but of course necessary, as asking churches and mosques not to open, we needed some consultations. I know we are in an emergency situation, we need to act fast, but consultation doesn't mean 1 week workshop or etc. That we should have reached out to the leadership. If that wasn't done, I think it was a big oversight, and steps should be taken to rectify that.
The Orthodox churches, the Catholic bishops,
yes, but still, people, when it comes to issues of faith, and culture, tradition, we shouldn't look at, okay, one set have done this, etc. Let's reach out to them. I don't think it costs anything. But what I think the religious leaders also need to realize is that we are talking about lives.
And a pandemic.
We have examples of what has happened in other countries to guide us. So it is not just a question of people disrespecting you, but it is a question of what needs to be done to ensure that we are there as human beings to worship tomorrow. And of course, changes can always be made. We have taken the basic precepts, established by Christ, and we have built on it and built on it. So a lot of the things that maybe perhaps we are standing on now to say we won't do, were not things that started from the time of Christ and the apostles. They are things that we have added on. And what we have added on, we can always modify.
Okay.
And so I think that we should appeal to the faith leaders. But the issue of the nightclubs, I think it's a very interesting point that we need to take a second look at that.
Okay.
Banks and malls, they are necessities. So I don't see why we should conflate that with this.
Okay.
But the nightclubs, I've seen a few wayside ones where I live. And if you see the number of people packed there, night after night, I don't want to mention the area because they'll see the thing.
That's fine. That's fine.
But I think we need to place a halt on
a
ban on those.
Ignatius, we know that in South Korea there was a patient 31 who actually visited a lot of churches and was just spreading the virus. Should the president had engaged charismatic leaders, had a stakeholder consultation before banning church service?
Well, honestly speaking, I respect the view of the charismatic churches in this moment. However, I think we should all be looking at the emergency situation in which we find ourselves, rather than throwing maybe some kind of little bit of tantrums here and there for not consulting and all that. Mind you, if one member in their church contracts it, just imagine. Go to how big Action Chapel is.
Not that you are pointing that out.
Yes, but I'm
a lot of the churches are massive.
Yes, massive. Very, 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 very huge auditorium. I've been there a couple of times, though I'm not a member, but I like going there. That's why I mentioned their name anyway. But then, I think we should rather be looking at it from the emergency situation in which we find ourselves. And how we can all put our hands to the wheel and ensure that things work for us. And then we yield the results that we want to get. If we are going to, be
nitpick
and say no consultation. Yes, consultation is good when it is practicable, but in a state of emergency, it is practically impossible to engage with stakeholders. That is why there are even certain conditions in the Constitution that allows the president to take certain decisions in certain situations. So I think we should all rally behind them along that line.
Okay.
But then with the issue of they raised the issue of the nightclubs and then the churches and all that, drinking sports, which are operational. I think they are a bit right. However, business, the nightclub is a business. Duly, I'm not a lawyer, but then I know it is duly registered and all in certain ways. So closing them down you would need certain powers of a court probably to actually.
But some of them have already started closing themselves
and
down, like Republic
in this situation.
and others.
In this situation, I don't think there is going to be any Ghanaian who would decide to move to a nightclub in this situation when your church is being closed down. You can't bank on it though. You can't bank on it though.
Thank you guys so much for being with us. We've run out of time. I was joined by Ignatius Terrence Nnubeng, who's the Director of Advocacy and Research at the Africa Center for Health Policy, and Ibrahim-Tanko Amidu, who's the Executive Director of Star Ghana Foundation. Up next, we'll be learning about coronavirus, everything you need to know. So if you have any questions for David to ask our health professional, let us know with the hashtag Breakfast Daily and our WhatsApp line 0550585832. If you're outside Ghana, don't forget that the country code is +233.
We hope you've enjoyed the show. Make sure you subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.